Welcome to Medica Nova Wellness Studio. I'm Dr. Angelika Maria Koch with the educational videos about optimal health and the most innovative and holistic approach to your well-being. So by the end of this week, I will participate in a social media webinar hosted by the Bioquantum Academy in Canada about the topic uterine fibroids and how to manage and heal this challenging situation with natural and effective therapeutic tools. So I thought, let's make a video about that at this channel, Medica Nova Wellness Studio, and I think you're going to like it. To stay updated with my ongoing videos, I encourage you to subscribe to my channel, share and like it with your friends and family, and don't forget to click that bell as it notifies you every time I upload a new video. If you want to learn more about homeopathy, integrated mental health, health and wellness coaching, quantum healing, and so much more, have a look at my website medicanova.net at the online academy, where you will find comprehensive certified home study online courses. And if you are interested in a health consultation either for yourself or your children, contact me at health@medicanova.net. So what are uterine fibroids? Well, uterine fibroids, they're also called uterine leiomyomas, and they're extremely common. They say about 75% of women have experienced at some point in their lives, and they're either the size of a few millimeters, size of a pea, or even a grapefruit. According to a report published in the New England Journal of Medicine, fibroids are the most frequent indication for major gynecological surgery. The fibroids are non-cancerous tumors, and they're found within the uterine walls, often resulting therefore in the change or the size of the uterus, and therefore can show up with some symptoms. Now, because they normally develop within the uterine wall, they're also called uterine fibroids. Some women experience a lot of symptoms like pain, menstrual changes, complications, backache, the list goes on. And some women are completely symptomless, and they only find out that they got a fibroid with a routine exam or when they're pregnant and they have an ultrasound. About 70 to 80% women experience fibroids, by the age of 50. But as I said, some will remain completely clueless that this is going on. The symptoms of my heavy menstrual bleeding, menstrual period lasting 7 days or longer. There can be a bloatedness and fullness in the abdominal or pelvic region, pelvic pressure or pain, frequent urination, or even the difficulty of emptying your bladder because the uterus is pressing here on the bladder. I've seen a lot of constipation here, pain with intercourse, backaches, oh my God, so much, or leg pains. There can be reproductive issues with infertility or even risk for miscarriages. Fibroids, they can increase in size during pregnancy due to the increased level of estrogen. And the bleeding and abdominal pain might also occur during pregnancy if the fibroid begins to lose its blood supply. But here you will have more ultrasounds and more monitoring sessions. But did you know that studies actually have shown that preventing or treating high blood pressure helps to lower the risk of developing fibroids, especially in premenopausal women? There are different types of fibroids, and really that depends on the location, the size, and the number of fibroids, which influence the severity of symptoms in women. And here I want to stress that we talked about in the beginning managing and healing. In my experience, you can only heal or decrease the size of fibroids if the fibroid is small, like pea size. If it's already, has reached the size of a grapefruit, then I would say we only can manage it, even with complementary and alternative medicine. So the different types are intramural fibroids. For example, this is one which is the most common one. They grow within the muscular uterine wall, and if they're large enough, they can actually distort and stretch the uterus or the womb. They can also cause prolonged heavy periods here, along with pressure and pain in the pelvic region. Then we have the Sub-Serosal Fibroids, and here the fibroids grow outside the walls. And the uterus sometimes therefore presses on the bladder, or you have this feeling you can't empty your bladder fully. This type may also sometimes cause the backache here. The backaches may occur when this subserosal fibroids bulge from the back of your uterus and press therefore on the spinal nerves, causing the backache. And then we have the penetroculated fibroids. In these fibroids, they grow in small stalks inside or outside of the uterus. Submucosal fibroids, they just sort of grow underneath the uterine lining. And this type again is more likely to cause heavy, prolonged menstrual bleeding. But they are less common really. And then we have the cervical fibroids, and as the name says, they grow in the cervical tissue, but they are rare compared to the other ones. The causes, I would say, hereditary. So if your mother or your sister had it, you're more prone maybe to have them. Age, yes, women between 30 and 40, are more prone to it. And also I would say race here. African American women are 2 to 3 times more at risk here to develop fibroids. Obesity, bring down your weight, because it just adds to the development of the fibroids. High blood pressure, I mentioned already, there seems to be a link between that and the increase of women's risk of fibroids. I would say also hypothyroidism, underfunctioning of your thyroid, because your hormonal situation is completely out of whack here, and that can add to the presence of uterine fibroids. In general, if you expose yourself to a diet which is poor in meat, processed meat particular, but we talk about diet in a minute, and particular pork, there is also a link with increased risk for fibroids. Girls who have their periods before the age of 10, there should be, a link here as well, or it's just that the hormonal imbalance is just a nice sort of breeding ground to develop fibroids later on. Birth control pills, so taking birth control pills can make fibroids grow more quickly because of the increased estrogen level in the body. So fibroids seem to grow from a single smooth muscle cell, but then continue expanding where they shouldn't. So since fibroids run in the families, they appear to be genetic to some extent. But for example, identical twins are more likely to both have them than non-identical twins. And hormone imbalances are another root cause of fibroids. I think in my practice probably it's the top of the list here. Estrogen and progesterone hormones are responsible for stimulating the growth of the uterine lining each month in preparation, of course, for possible pregnancy. Now, estrogen and progesterone also appear to promote the growth of fibroids, which contain more estrogen and progesterone receptors than normal uterine muscle cells. Another reason this hormone theory makes sense, because when women go through menopause, depending on the size, the fibroids disappear, right? And that's why I think the hormonal link here is very important. Now, fibroid surgery might be recommended for women with severe symptoms, in particular those with dealing infertility or those who are at an increased risk of dealing with complications during pregnancy or labor. And of course, this surgery will happen before the pregnancy. Now, I want to give you some food for thought today, the metaphysical meaning. Because sure, we have the hereditary part, the diet part, and the environmental toxins, and also on they all add to it. But usually there is a story, and a mental and emotional story behind the formation of fibroids. And I want to share that with you, because I think it is important for you to really look within, what is stopping or hindering the healing of fibroids within your body. So I always refer to Jacques Martel's book of the Complete Dictionary of Ailments and Diseases. And he enlightens us that the uterus symbolizes, he says, my status as a woman. It is the core of my creativity. It also represents the power to give birth, security and warmth. It is a refuge. It is in this warm and safe sanctuary that nidation or implantation takes place. If a disease develops in my uterus, such as a tumor for instance, I ask myself how I perceive the sexuality of others and especially that of my children and grandchildren. Do I have the impression that it is not okay? Is there something I find ugly about my children or their lives as a couple? Am I bothered about the role or the place that each member of the family is taking? Am I losing my little ones because they are growing too fast? I would like so much for them to remain small and safe. Do I feel that they are in any moral or physical danger? And do they risk injuring themselves? I almost feel it is my duty to resume the role of a parent with my grandchildren. My feeling of freedom is thus once again curtailed. It is as though a misfortune were threatening my family and my home. All these questionings may concern my real children or grandchildren, or a nephew, or a neighbor, or a pupil whom I consider as such. I hold on to so many things from the past that it prevents my creativity from expressing itself. I turn down the child that I am and that I stored in a box in the belief that this is what I must do when I become an adult. Deep down, I want to move forward and accomplish things, but I'm frustrated because something is preventing me from doing so. When there's retention, I become aware of the state of fear in which I am. I'm afraid of letting go. I worry I cannot let my little ones go out into this new world, and I try to hold part of them back. I therefore lose blood, which is related to loss of joy. I'm losing the joy of having this child in me, for soon they must face the world, and I'm afraid for them. So the positive affirmation would be, I accept to be reborn to be myself. Instead of wanting to silence the customs that dictated my life, I accept to integrate them harmoniously. I become aware that I have no power over the lives of others and that everyone lives their own life in their own way. I have given my children the best education in the best possible way, and I can be proud of it. I accept to allow the child in me to live, and who is love, joy, and hope. So I want to give you some ideas here that uterus creates or symbolizes creativity. It creates life. It creates your vision. It creates your ideas, right? It creates everything what's inside of you. But because of some obligations, and in this case, obligation to a duty, too much duty towards your own children or grandchildren, your own creativity is hindered, is limited, is sort of held back. So I have some thoughts about it, because I really would like you to go into these stories as well. Let's talk about natural treatments. Well, some risk factors for fibroids are out of our control, but there are many you can manage. And I want to go back to Dr. Axe's diet suggestions here. They're very good, and I think they give you a good idea. So avoid foods that make fibroids worse, and in this case, high-fat processed meats. They're some of the worst food choices, he said, for women when it comes to fibroids. foods high in unhealthy fats like non-organic processed meats or trans fats like hamburgers or processed breakfast sausages can increase the inflammatory levels within the body. Now, processed foods also contain chemical additives and other ingredients that promote the inflammatory part within the body. So when you do eat beef, always try to eat grass-fed meat. Conventional dairy is the same thing here because they can be high in steroids and the hormones and other chemicals that may alter your hormone levels when eaten in high amounts. It's all about keeping your hormonal status in balance. Refined sugar, the same with refined carbohydrates. They're all about sugar because they can create inflammatory conditions within the body, increase pain, and also reduce your immune function. They also add to increased weight gain, and which is another factor which could add to the development of fibroids. With refined carbs, I'm talking about here, white flour, bleached flour, bring in really whole grains here. This is very important because the refined carbs, they sort of spike this insulin within the body, and therefore your hormones get completely out of whack. The same counts for alcohol. Alcohol really in itself is sugar, and it just reduces your immune function. Caffeine is also taxing on your body, especially the liver. Now, when you give your liver more work to do than it can actually handle, it isn't going to do a good job as it should be. And the function of the liver is really, it keeps your hormones in check. And when your liver is sort of taxed and cannot detoxify waste products from your body, your hormone levels are affected. So that's a big part here. So bring in organic foods, really, free of pesticides or commercial sort of chemicals, because they impact the estrogen levels within your body. Bring in lots of green leafy vegetables, particularly the one which are rich in vitamin K, because it adds to the blood clotting, because women with fibroids have a lot of bleeding, right? Cruciferous vegetables, you want to bring in broccoli, cabbage, Chinese cabbage, tomato, apples. They all seem to be to have a protective factor for uterine fibroids. Beta carotene rich food, because the human body turns beta carotene into vitamin A, which promotes the growth and repair of healthy tissues. Then, as I said, a lot of women experience heavy bleeding and therefore can end up with anemia. So you want to bring in high iron-rich food. And I would say, grass-fed beef is here very good in this case, or legumes. But I also want to suggest Floradix, which is herbal iron supplement. You get it in your health food store. Sort of a bottle, a liquid bottle, comes from Germany, the product, and it doesn't cause constipation. So 2 or 3 times a year, consume a bottle of Floradix. I think that would help you too. You want to bring in some good oils, in this case flaxseed oil, because it balances the estrogen level in your body. It can be 2 tablespoons in your cereal or put it in your smoothie. The natural supplements, I would say keep it simple but effective. You want to bring in Vitex or Agnus castus. It's also called chasteberry. You want to bring in 400 milligrams, maybe twice daily. It's sort of just levels, reduces the estrogen amount but promotes the production of progesterone. You have to take it quite long, maybe 6 months to a year. You want to, as I said, lots of good oils. Fish oil, at least 1000 milligrams daily. Flaxseed oil, 1 tablespoon at least daily, because it sort of calms down the inflammatory situation within your body, which seemingly adds to the development of fibroids. As well as we want to bring in a B complex, vitamin B complex. The vitamin Bs, if you lack them in your diet, the liver is missing some of the raw material it needs to carry out its metabolic processes and therefore regulate the estrogen levels. Some women choose to take progesterone cream. I personally like progesterone oil. You know, that works better for me as well. In my practice, I've seen that it can help out to balance the progesterone. If your liver is already taxed, I would bring in milk thistle and dandelion. You can bring that in a herbal extract, in a liquid extract. I think I like that better than the capsules, because the liver likes something sort of which can immediately, assimilate. And herbal extracts are quite good here. Holistic practitioners believe that fibroids are also sort of the hub for accumulation of toxin. So external application of castor oil packs are really helpful here, because they draw out the toxins from the fibroids. And I know there are not studies about it, but castor oil packs are really effective in drawing out toxins. It's really great. Then of course exercise, move my body, avoid environmental toxins and so on. In my practice, I have more results if I follow all these lifestyle changes, dietary changes, the supplementation, but then bring in homeopathic remedies. By now you have got the idea that each woman has an individual expression about their fibroids. Some have heavy bleeding, some have backaches, some have clots, right? Some have this bearing down sensation. So here you want to choose a homeopathic remedy which sort of really expresses the main symptom of your individual fibroids. And then it works very, very well. Now, can homeopathy cure uterine fibroids? I would say yes, it can cure uterine fibroids, because uterine fibroids fall in the category of diseases that the conventional mode of medicine class as surgery, right, by nature. But homeopathy can help manage the symptoms of uterine fibroids as well as dissolve them, but that really depends on the size of the fibroid. I make a really big underline here, because people always think like, oh, please help me. Well, you can help only so much, according to the size of the fibroid. But here it's very vital that you consult a homeopath, professional homeopath, or contact my practice, medicanova.net or health@medicanova.net, to make an appointment and to look for a consultation. You can't, give some dosage plan here via YouTube video. It's not really good. But some of the suggested homeopathic remedies today you are able to purchase at your local health food store. And some of them today you will have to order online. The best homeopathic pharmacy, in my view, is Helios Pharmacy. They are located in the UK, but they ship internationally, and their website is helios.co.uk. They are really superb homeopathic remedies. They're made from homeopaths, so it's like having a Michelin chef in your kitchen. So I rather choose that. So the first remedy is called Slasby bursa pastoris. And here the emphasis is on uterine fibroids with prolonged menses, right? It's one of the top grade remedies for treating uterine fibroids with prolonged menses, meaning your period continues 10 to 15 days. The period appears very frequently as well, and the next menstrual cycle appears even before recovery from the periods has occurred, right? I mean, you hardly can catch up here. Menstrual bleeding is profuse with the presence of large clots. And there is also violent colic, uterine colic during menses. There's cramping pain in the uterus. The next one is Calcarea carbonica. Again, the emphasis is on heavy periods. Heavy periods from the uterine fibroids, and they continue for long and may even appear early. With that comes also vertigo. And with that, and that gives it away, that differentiates it a little bit with the first remedy called Spirosa pastoris. With Calcarea carbonicum, you have a thick, milky or yellow color. We call it vaginal discharge or leukorrhea. That's another sort of keynote here. Now, if you have uterine fibroids, but where the period is, or the menses is very painful, we have two major remedies called Belladonna and sepia. Now, Belladonna is best described where there's cramping pains in the uterus, but there is this bright red blood, right? It's like really, you can't miss it. It's not dark blood, it's bright red, and it's very profuse. Whereas in sepia, you have this griping, burning, and this bearing down pains during the menses. Bearing down pains means you stand up and you feel like as if sort of the inside, the organs in your pelvis are sort of dropping down between your legs down to the ground. It's a very specific feeling of bearing down pains. Menses start early and are quite copious. Copious means a lot. There can be even fainting and chilliness during the menses. And it's also very specific, indicated for treating painful intercourse in uterine fibroid cases. If you have dark menstrual bleeding, right? It's not light and bright like Belladonna, but dark. We have Ustilagus medis. I give you the name. I know they're difficult names, they're Latin names, but I write them down so you can see them just below. Again, we have here, the blood is very dark. The clots may be present in the menstrual blood, and it can be also stringy in nature. That's another keynote. Now, if you have lots of clots, right, if the emphasis here is more on Jesus, that blood is so full of clots. Think about Sabina officinalis. It's great here, and it's sort of the bleeding comes with the slightest motion. Pain from the sacrum to the pubis is another attending feature, and during the menses there can be pain in the uterus, and it gets better from lying on the back. Now, the uterine pain here extends to the thighs even, right? Then we have the leg pains coming in. Other symptoms are here also the foul, acrid, corrosive, yellow leukorrhea, right? Vaginal discharge, like a little bit like sepia as well, or Calcarea carbonicum. Now, if you have only the bearing down sensation, what I just talked about, sepia officinalis, think about Fraxinus americana as well. Again, top grade remedy for uterine fibroids, which is mostly recommended when the major indicating feature is this bearing down sensation. I often also give sepia, in this case 200, maybe on a weekly basis in Fraxinus americanus, either in a herbal tincture or homeopathic potency, very low, maybe 6 only on a daily basis. Here, maybe even bring in 2 remedies. That helps as well. Now we have the back pain, right? So you get the idea, right? Every woman is unique. Every woman needs an individual targeted treatment protocol here. That's the only way how to break through this really challenging situation. Now, if you have uterine fibroids with back pain during the menses, I suggest the 2 remedies, Trillium pendulum and Kali carbonicum. Kali carbonicum you can get in your health food store as well. In uterine fibroid cases with back pain during menstrual cycle, Trillium pendulum comes highly recommended here. The pain may radiate to the hips from the back during the menses, and tight binding the back or hips maybe promotes a little bit relief here. But menstrual bleeding is bright red and gushing. Slightest movement again worsens the uterine bleeding, like Sabina, same thing. But Trillium pendulum is also indicated for intermenstrual bleeding every 2 weeks. So you have your period, and in between you have another period, right? And it just goes on. Again, another attending feature is faintness from uterine bleeding because it happens so much. Kali carbonicum is really indicated for violent backaches during the menses. The pain gets better from sitting and pressure. Women want back massages. It's a fantastic remedy, for example, if you have backache during labor, right? It's fantastic remedy, so don't forget that. If you have frequent urination, remember we talked about that the uterus can press on the bladder, or you feel like you can't really empty the bladder. Erigeron canadensis, fantastic remedy here too, indicated for frequent urination in case of uterine fibroids. In some cases there may be even painful urination. And the attending features are excessive menstrual bleeding, which is bright red in color, and Erigeron canadensis is used again for intermenstrual bleeding from slight exertion. The last two remedies, if you have so much heavy bleeding and you end up now with anemia, like you feel totally exhausted, right? You end up with a white pale face. You're thinking about remedies, China officinalis or ferrometallicum. Both remedies are effective remedies for treating uterine fibroids with heavy bleeding and anemia. China officinalis works best where we talk about profuse dark menstrual bleeding, lots of clots again, but there's total exhaustion and anemia. I mean, you just feel like you can't do anything anymore. There may be even fainting spells involved. Whereas ferrometallicum is best used when the symptoms include this pale, watery, heavy, prolonged menses. Even the blood gets pale, leading to anemia. The menstrual flow again worsens with every slightest movement here. There may be lower back pain involved, and the abdomen is painful. It's just, you're losing your red blood cells, right? That's what it boils down to. Homeopathy is just so great here, right? Because you get the idea that we need an individual targeted treatment protocol. And the combination, as I said, with lifestyle changes, diet changes, supplementation, as well as the combo with homeopathic remedy, will get you somewhere. And I hope this short video, yet packed with vital information, again inspired you to seek out natural effective solution in healing your uterine fibroids. Don't forget to subscribe to this channel, share and like it with your friends and family, and don't forget to click that bell as it notifies you every time I upload a new video. So till next time, much love, take care.